Hi, JIP DYK 3 PM program 3 point medics ப்ரோக்ராமில் உங்களை சந்திப்பதில் மகிழ்ச்சி அடைகிறேன். ஸோ இட் இஸ் தி கண்டினியூஷன் ஆஃப் எஜுகேஷன் ஆன் prothrombin time. So what are the 3 points about prothrombin today? So increased prothrombin time always indicates two important reasons. One, either there may be liver pathology, or second one, there is some interruption against vitamin K function. Okay. Point number 2, why in liver pathology and vitamin K deficiency this prothrombin time is getting prolonged. So normally any coagulation process involves two things. One is primary homeostasis and another one is secondary homeostasis. For example, if there is any cut injury occurs, so immediately platelets will be driven to particular site and all platelet aggregation will be formed. This platelet aggregation will cause a plug. Okay, that's called primary homeostasis. And secondary homeostasis means once this platelet plug is not sufficient, what happened? Our clotting factors will be stimulated. So at the end of stimulation of clotting factor, then you will be formation of fibrin. Then third one, this fibrin and this platelet will combine together and that will complete the coagulation process. What you have to remember that the platelet plug formation will be inhibited by aspirin. So aspirin basically inhibits platelet plug formation, so it doesn't interfere with clotting process. So strictly speaking, if you take on aspirin, that will interfere with your bleeding process, not the coagulation process. So bleeding time may be prolonged in those who are taking aspirin, but the clotting time will be preserved. And likewise, these clotting factors generally produced in the liver. But during the time of clotting factor synthesis, vitamin K is essential for carboxylation of this vitamin, all clotting factor, or otherwise I could say the clotting factor synthesis is promoted or accelerated by vitamin K. So when vitamin K is not available either in the form of malnutrition or poor intake or any kind of intestinal malabsorption syndrome secondary to celiac disease, okay, or cystic fibrosis. So whatever reason vitamin K is not available in our body, liver is able to produce clotting factor, but during the process of clotting factor formation, vitamin K is essential. When vitamin K is not there, then these clotting factors won't be produced. So vitamin K, either as I told you earlier, because of poor absorption secondary to the above causes, or vitamin K can be artificially inhibited by the drug, that's called warfarin. So either by drug inhibition or due to non-availability of vitamin K may result in disruption in clotting factor synthesis. Or when you end up in liver failure, even though vitamin K is available, but when liver is in failure, liver can't initiate any kind of beginning process of clotting factor. So the two main reason, either vitamin K deficiency or liver disease, can increase prothrombin time. Point number 3, before you assess prothrombin time, please make sure that there may be interruption in the results of prothrombin time. If patient is highly lipemic, for example, if the triglyceride level around 2000, or patient is highly icteric, or patient has hematocrit more than 55%. So these are some conditions can interfere with prothrombin time estimation. So you have to be careful there. Thank you.